At what point in this markup are we going to have cost estimates?
Well,
This is the most incredible markup I've ever been in my years in the United States Senate and Congress. We have this bill with no estimate as to how much it's supposed to cost.
Some of us are concerned about the slippery slope to single payer. This is a greased slide to single payer. It's not about the issue of care. It's not about the issue of coverage. It's more about the issue of control. If it were about the issue of care or coverage, then we would have had a bill that proposed coverage. We would have had a bill that addressed quality care. What it's about really is centralizing control right here amongst folks who think that they really know how to run something from a central system.
Well, this bill has just been accused of being somewhere or another a combination between Rube Goldberg and Karl Marx. However, our current system is a combination of Adam Smith, Darth Vader, and the invasion of the body snatchers. So I like our plan better.
Do I look like a body snatcher?
Don't ask that question, Judge. I think I know why we're not seeing the legislation well in advance, because the states, the governors, regardless of whether they're Republican or Democrat, would be opposed. Because it's Medicaid that is the boogeyman in the state budgets right now. They've got to get control of it. But we do nothing in this bill to address the problems that exist in Medicaid. And at the top of the list is $18.6 billion worth of improper payments.
How in the world do we expect to reasonably authorize, maybe there's good things, maybe there's not, in this without a cost estimate? It is a joke if we run through this stack of papers here without having some provision, and I suggest we not move forward until we have some provision as to how we're going to pay for it.
60 years have gone by with Republicans and Democrats that have sat at tables like this at one point or another, or sat at meetings with the goal in mind of achieving the result that we've been asked to achieve. And they've all failed at it. There have been aspects that have been improved, but not the comprehensive approach we're taking. And I'm just still a believer that we can do this.